Every year in February, Black History Month is celebrated to highlight the African American stories and accomplishments of national importance. While such figures as Frederick Douglass, Harriet Tubman, Langston Hughes, Martin Luther King, and several more are certainly worthy of regular attention and celebration, here in Delaware, we have our own list of African Americans who have their stories and achievements that should never be forgotten. Today, we will share just a few of them. The Department of Health and Social Services is one of the largest agencies in state government, with 11 divisions and more than 4,000 staff and a budget of more than $2 billion. DHSS, in one way or another, affects almost every citizen in our great state. Our department's mission is simple, yet profound: to improve the quality of life for Delaware citizens by promoting health and well-being, fostering self-sufficiency, and protecting vulnerable populations. The legacy and impact of African Americans in DHSS history is remarkable and transcending. We know there are many more who have made a significant impact on DHSS, but join me in this journey, highlighting a few of the department's trailblazers, many being the first of color assigned to their role. Herman Holloway was the first African American elected to the Delaware State Senate in 1964. He championed civil rights and racial equality for his dedication to bring Delaware's human service into the modern age. His legacy of leadership in the area of health and social services for Delawareans is unparalleled. To honor that commitment, the Herman M. Holloway Senior Health and Social Service Campus was named for him. Dr. Charles Debnam was the pioneering public servant who envisioned and created the Division of State Service Centers system in Delaware. His innovative work aimed to improve services and the accessibility for the state's residents, particularly children. Dr. Charles H. Debnam's legacy lives on through the positive impact he made in Delaware. To honor his commitment to the community, the Charles H. Debnam Building on the Herman Holloway campus was dedicated in his honor. At the age of 16, Winder Porter went to the University of Pennsylvania, where he received his medical degree. Dr. Porter was the former director of State Division's Public Health Venereal Disease Program. He was employed by the state of Delaware longer than any other physician with the Division of Public Health. His service and commitment to the health of Delawareans led to the state naming the Porter State Service Center, located in the city of Wilmington, in his honor. Jane Mitchell broke the color line as the first African American to work as a nurse in Delaware. In 1949, she was hired to work at the Governor Bacon Health Center on the Holloway campus, being the first Black nurse to work with patients of all races in a state hospital. She later became the director of nursing at the Delaware State Psychiatric Hospital, in which a portion of the building was named the Jane Mitchell Building. Dr. Henry Smith III served in the leadership capacity as the Deputy Cabinet Secretary at the Delaware Department of Health and Social Services. Dr. Smith brought a wealth of knowledge and skill set, having served in a number of state government positions, such as the Budget Office and the Director of Department of Service for Children, Youth, and their Families. We thank Dr. Smith for his ongoing commitment as a community advocate that continues to bring positive change to Delaware. Alice Coleman is the first African American woman employed by the Delaware Psychiatric Center, Delaware State Hospital, as a psychiatric social worker supervisor. Later in her career, she moved into the role of Director of Social Services. Ms. Coleman remains a strong leader and advocate for people who live with disabilities, social injustice, and mental illness. Lisa Blunt Rochester served for 5 years as the Deputy Secretary of Department of Health and Social Services, where she leveraged her professional experience to advocate for the health of all Delawareans. Congresswoman Lisa Blunt Rochester began her Congress service in 2017 and continues to be a voice to champion health for all. She is currently running for the office of U.S. Senate. There, she will continue to fight for the citizens of Delaware. Carol Hubbard, Esquire, served as the department's Director of Division of Child Support Enforcement, now Child Support Services, and as a leader of the DHSS Administrative Service. She left an indelible impact through her commitment to service. Ms. Hubbard's dedication continues as she leads the Department of Labor as Secretary. Dr. Kara Odom Walker served as the first African American Cabinet Secretary for the Department of Health and Social Services. Her accomplishments were many at DHSS, which include creating a state reinsurance program that reduced premiums in the first year and increased the number of people covered, and shaping new Medicaid managed care contracts with quality metrics. Ray Fitzgerald worked for the Division of Social Services for more than 15 years and later became one of the first African American Social Service Division directors in 2015. DSS oversees cash assistance, child care benefits, federal food stamp program, and determines eligibility for Medicaid. Currently, Ray serves as the Executive Director of the Wilmington Housing Authority, changing the way we do housing in Delaware. As the first African American to serve as the Director of Information Resource Management at the state of Delaware, Midge Holland led with excellence. During her 35-year career with the department, she was one whom you could depend on to get the job done. As a proud Delawarean, she was committed to each of her assignments and roles, whether law school, Department of Corrections, Kids Department, Domestic Relations, Treatment Access, or even DHSS. Dr. Valencia Lynn Beatty, Esquire, provided leadership as the Director of the Division of Management Services for DHSS for 10 years. As one of the African American DHSS Trailblazers, she was known for her managerial skills. Lynn is now serving as Delaware Technical Community College's Vice President for Human Resources, Equity, and Inclusion. Charles Chuck Hayward has served in the state government for the past 28 years, mainly focused on Delaware's children and families. Chuck served as one of the first African Americans in the leadership as the Director of Business Administration and General Services. He also served as the Director of the Division of Economic Services, the Division of Social Services, the Acting Director for the Office of the Medical Examiner, and he retired as the Director of the Child Support Enforcement, now Child Support Services. Chuck continues to provide his leadership skills while assisting the Division of State Service Centers as the Special Projects Coordinator. Serving for 4 years as the first African American director in the Division of Visually Impaired, Robert Doyle worked in partnership with those who are visually impaired and empowered them to become self-sufficient. Robert Doyle currently is the director of the Division of Blind Services at the Florida Department of Education. Gloria Upshur worked for many years in the Division of Social Services before being selected as the first African American director of the Division of State Service Centers. She was significant in continuing the legacy and the dream of Charles DeNab to ease access to DHSS services with the statewide 15 service centers. Dr. Pamela Williams was the first African American woman to hold the position of Director of Constituent Relations and the Office of the Cabinet Secretary. As director, Dr. Williams coordinated responses from legislators, governor's office, as well as other departments within the state on constituent issues, as well as oversight of the Adult Protective Service and state long-term ombudsman program. Her dedicated work ethic was recognized by many of her colleagues, making her one of the most well-respected state of Delaware constituent directors. Renata Henry has over 35 years of experience in the behavioral health field, serving in clinical and administrative positions in community-based health programs, substance abuse organizations, and leadership positions in state and county government. She was the first African American director of the Division of Substance Abuse and Mental Health. She led many collaborations of systems to ensure that policy and practice were aligned to support. As a board-certified physician in the areas of addiction, public health, and general preventative medicine, Dr. Herman Ellis served as the former medical director of the Delaware Division of Public Health. In that role, he served as Chief of Statewide Clinical Operations. He was the first African American male to serve in that position at the Delaware Division of Public Health. He received recognition from the Delaware Assembly for his outstanding work in Delaware. His commitment to Delaware is evident as he is presently practicing preventative addiction medicine and treatment in addition to primary care with an emphasis on nutrition and alternative health at the Choice Recovery Clinics in Delaware and Maryland. Dr. Owele Maduka Eze is one of our trailblazing medical directors for the DHSS Division of Public Health back in 2012. Prior to joining the DHSS family, she was an attending physician at Christiana Care, specializing in infectious disease. After spending time as the medical director for the Department of Corrections, we're excited to announce that Dr. Maduka has returned to the Division of Public Health as medical director. Dr. Older Jane Tillman's life was devoted to preventative medicine and public health. She was a wise and ardent champion of public health. We recognize her as the Chief of Community Health Services for the Delaware Division of Public Health. She had a unique ability to explain complex medical issues to the public in very understandable terms. Dr. Tillman demonstrated her deep wisdom and as well as her passion for welfare of others. Susan Holloway served as the first African American Deputy Director of the Delaware Division of Substance Abuse and Mental Health. With over 24 years of experience, she played a crucial role in overseeing and managing programs related to substance abuse and mental health in Delaware and the Division of Public Health. She currently is the Executive Director of the Delaware Prescription Opioid Settlement Distribution Commission in the Office of the Lieutenant Governor. Barbara Paulin worked in the state of Delaware, where she became the Director of Child Support Enforcement, now Child Support Services, retiring in 1999. During her tenure as director, many witnessed her strong dedication, leadership abilities, and expertise firsthand. Barbara was given the responsibility for the development and implementation of computer systems to be used as a model for other child support agencies across the country. These are your DHSS Trailblazers. We thank you for your commitment of service and leadership.